Hey everyone, this is Dr. Jamie LaViola with Dental Masters of Alexandria, and today we're going to take a step back from the usual medical and dental jargon that I love so much, such as dental implants or CBCT scans, histology, zirconia, things like that I could talk all day. And we're going to talk about something important called Dr. J's Care Framework. And this is something that I use to help support patients and help them navigate the emotional piece of getting through treatment. So what is Dr. J's Care Framework? It breaks down into 4 components that I believe are really important: cultivate trust, address indecision, reduce fear, and encourage positive visualization. So to kind of explain and go through the framework, I'm going to go ahead and use a patient that recently came into our practice that I used these 4 components to really build rapport and help this patient get through the process of treatment planning and onto treatment. So this patient came into our office needing basically a full mouth solution. Had a lot of things going on, and he was trying to find out what was the best way to move forward. So we started off by cultivating trust, and he had been to 2 doctors prior to us, came to us, went through a consultation, we did our bone scan and gave him a treatment plan, actually 2 different treatment plans that we went through. And I also happen to know that he went to another 3 or 4 doctors, I think in total 7 doctors. But where we really stuck out is there was a lot of questions he had, and we knew that it took time, and so we just were really there to answer all of his questions and really also be open to allowing him to go to a second opinion so that he could see that we were here for his best interest. So cultivating trust is really important, and it's important that you have trust with your dental provider or medical provider. So next we had to address indecision. And this patient, because there was 2 different ways that had been presented by other doctors, we reviewed the treatment plans, and there was 2 different ways that the patient could have moved forward with treatment. One that I preferred, but both of them were viable options. And it's really important that you sit down and you discuss the pros and the cons, the risks and the benefits of whatever treatment options are available. And for him, he had the ability to keep some of the teeth that were still healthy and do some bone grafting and replace the other missing teeth with implants. Or he could start over by removing the teeth that were there and basically get upper and lower implant row of teeth supported by implants. So helping someone through this process and understanding why it's best for them. So in his case, after really sitting down and going through all these things, we decided to move forward with removing all the teeth and going forward with fully supported row of teeth, upper and lower, with implants, what we call in our office one-shot smile. So the next piece is reducing fear. And for this patient that came in, he had been fighting to keep his teeth for years, coming in every 3 months, getting cleanings. And so part of his fear was losing the rest of his teeth. And where we stepped in was to really make him understand that the teeth that he was going to have removed and replaced were really removing unhealthy teeth to begin with and replacing them with healthy, something that's going to last a long time, and replace the existing teeth that he had with something more functional and just as aesthetically pleasing, because his smile actually looked pretty nice besides the teeth missing in the back. So everyone's got different fears. In this case, again, it was fear of loss of teeth, which is a real thing. So we navigated through that and really landed in a place where he was comfortable finally with that piece. So the last piece of the framework is encouraging positive visualization. And so as we talked about, we got over the fear, and we did so by actually moving into encouraging the positive visualization so that we can focus on what he was gaining instead of what he was losing. So how do we do that? We basically went through our record taking, facial scanning, and teeth scanning so that we could basically put together a design and the patient could actually see what his teeth were gonna look like. And by doing that, and also showing some testimonials of patients that were very similar, been through similar process, and hearing how they were able to chew normally, smile comfortably with confidence, this is where we really help to have him understand what it's gonna be in the future and really, again, focus on what he's gaining. So that's Dr. J's Care Framework in a nutshell. It's not something that you may hear me talk about frequently, but it's something that is most definitely in the back of my mind that I use with each and every patient that comes through the door. Because it's not just about giving you a new set of teeth or cleaning your teeth. It's about these things that are important psychologically and emotionally. So it's really important for you to know that when you come into Dental Masters, I don't just care about your teeth, I care about you.